Hello and welcome to Aortic Hope's YouTube channel, AHTV. I'm Molly Thomas, bringing you the Week in Review. This week's Week in Review is brought to you by Edwards Life Sciences and Cook Medical. We thank them so much for their sponsorship and support. And if you'd like to read more about all the great things they do for aortic disease, check them out on our homepage. And don't forget to like and subscribe and get notified for any time that we drop something new on our channel. All right, let's get started with our Medical Monday. And this Medical Monday is brought to you by Ani. He's one of our awesome med students that we have supporting our Medical Mondays and Topic Tuesdays. And behind every successful treatment plan is a team of specialists working together to provide care. And this month we are highlighting all the different specialists that you may see for your aortic disease concerns. So last week we kicked off our month-long dive into healthcare professionals who make up an aortic care team. Today we'll be discussing cardiac surgeons and their role in diagnosing and managing patients with aortic pathologies. From routine valve operations to life-saving emergency procedures, cardiac surgeons play a central role in the treatment of complex aortic conditions. So what does it take to become a cardiac surgeon? A cardiac surgeon is a physician who specializes in surgical procedures involving the heart, aorta, and other structures within the chest. There are a couple of different pathways to becoming a cardiac surgeon, but all require many, many years of training. First, there's 4 years of medical school, 5 to 8 years of general cardiothoracic or vascular surgery residency, possible 2 to 3 additional years of specialized cardiothoracic surgery fellowship training, depending on training pathways. Many surgeons then pursue additional training in aortic surgery, heart valve surgery, or other advanced areas. So here we have a diagram of the different pathways it takes to become a cardiothoracic surgeon. There's 2 different ways you can go. And as you see, it starts with medical school, clinical rotations, general surgeries. There's internships in general and cardiothoracic surgery, and then they branch off. It's a pretty impressive education and specializations. So by the time they begin their independent practice, cardiac surgeons have typically completed more than a decade of training after college. So what kind of aortic conditions do cardiac surgeons treat? Cardiac surgeons commonly care for patients with diseases affecting the ascending aorta and aortic arch, the portions of the aorta closest to the heart. Many cardiac surgeons also perform procedures involving the aortic valve, including valve repair and replacement when needed. While cardiac surgeons are known for operating, their role often begins long before a patient enters the operating room. They help determine whether surgery is needed in the first place, when surgery should be performed, and which operation is most appropriate, and how to balance surgical risks and long-term benefits. They work closely with cardiologists, vascular surgeons, anesthesiologists, radiologists, nurses, and advanced practice providers to create a personalized treatment plan. When emergency surgery is necessary, one of the most critical conditions treated by cardiac surgeons is an acute type A aortic dissection. As discussed in previous posts, type A dissection involves the ascending aorta. It's a portion of the vessel that sits directly next to the heart. Because this area supplies blood to the coronary arteries, brain, upper body, complications can develop rapidly. For this reason, an acute type A dissection is considered a true surgical emergency and falls squarely within the expertise of cardiac surgeons. These operations often require immediate intervention, sometimes in the middle of the night, to save a patient's life. And what is the importance of their experience? Well, aortic surgery is among the most technically demanding areas of cardiac surgery. Procedures involving the aortic root, the arch, or acute dissection often requires specialized techniques and coordination among a highly trained surgical team. It's not just a surgeon in there, it's a whole team. Research has consistently shown that patients tend to have better outcomes when complex aortic procedures are performed at experienced centers with dedicated aortic programs. The bottom line, cardiac surgeons are an essential part of the aortic care team. Their extensive training prepares them to manage a wide range of conditions involving the heart and aorta, from elective aneurysm repairs to life-saving operations for acute dissections and other surgical emergencies. While patients may only meet their cardiac surgeon during a stressful time, these specialists bring years of expertise and experience to some of the most challenging conditions in cardiovascular medicine. So tomorrow, for Topic Tuesday, which we will be discussing in one moment, we're going to be discussing the other half of the surgical aortic care team, vascular surgeons. In the meantime, think aorta. Thank you so much, Ani, for that wonderful article. And moving right along to Topic Tuesday, this is brought to you by Alvaro, another one of our medical students that we appreciate so much. So the vascular surgeon's role in aortic disease. So this is Alvaro, and today we're discussing the vital role vascular surgeons play in the management of aortic disease. When people hear the term aortic dissection, they often imagine emergency open heart surgery. While this is true for many type A dissections, the management of type B dissections, thorough abdominal aneurysms, and abdominal aortic aneurysms, they're very different and frequently fall under the expertise of vascular surgeons. Many diseases affecting the descending thoracic and abdominal aorta fall under the expertise of the vascular surgeons, from managing type B dissections and aneurysms to performing advanced endovascular procedures such as TEVAR and EVAR. Vascular surgeons are uniquely trained to treat complex aortic pathology. Their role extends beyond intervention, encompassing diagnosis, medical optimization, imaging, surveillance, and long-term management of patients with aortic disease. Here's a graphic here with all things vascular surgeon, all the aneurysms and all the different phases of the aorta. All right, where does vascular surgery take the lead? Although the aorta is one continuous organ, different specialists typically manage different segments. Pretty interesting to know. Cardiac surgery leads aortic root aneurysms, ascending aortic aneurysms, acute Stanford type A dissections, aortic valve and root reconstruction, complex arch procedures requiring cardiopulmonary bypass. These operations often involve the heart itself and require open chest surgery. That's cardiac surgery. So vascular surgery, this leads the Stanford type B aortic dissections, the abdominal, as descending thoracic aneurysms, thoraabdominal aneurysms, abdominal aortic aneurysms, penetrating aortic ulcers, intramural hematomas involving the descending aorta, TEVAR and EVAR procedures, fenestrated EVAR procedures, and branched endovascular aneurysm repair, BVAR. Vascular surgeons are uniquely trained in both open and endovascular reconstruction of the descending thoracic and abdominal aorta, allowing them to manage the entire spectrum of disease from medical therapy to highly complex endovascular interventions. The modern aortic specialist. Today, vascular surgeons do much more than implant stent grafts. They're responsible for diagnosing aortic pathology, understanding true and false lumen dynamics, managing malperfusion syndromes, performing TEVAR, EVAR, FEVAR, and branched repairs, treating thoraabdominal aneurysms, preventing rupture, providing lifelong imaging surveillance. As endovascular technology continues to evolve, Vascular surgeons increasingly serve as the primary specialist for disease involving the descending thoracic and abdominal aorta. This is why many patients with type B dissections or descending thoracic aneurysms or abdominal aneurysms, they'll spend most of their journey under the care of a vascular surgeon, from diagnosis to intervention and long-term follow-up. Understanding common aortic diseases where vascular surgery lead. Abdominal aortic aneurysms, or the AAA, it occurs when the abdominal portion of the aorta progressively enlarges due to a weakening of the vessel wall. Most AAAs are associated with aging, smoking, and atherosclerosis, and the major concern is rupture as the aneurysm grows. Vascular surgeons lead the management of AAA through surveillance, open repair, and minimally invasive procedures such as EVAR. Thoracic aortic aneurysm. So it's an abdominal enlargement of the aorta within the chest. As the aneurysm expands, the aortic wall becomes increasingly vulnerable to rupture or dissection. While ascending aneurysms are often managed by cardiac surgeons, vascular surgeons commonly treat descending thoracic aneurysms using TEVAR and open surgical reconstruction when appropriate. A type B aortic dissection occurs when a tear develops in the descending thoracic aorta, allowing blood to enter the aortic wall and create a false lumen. This abnormal channel can compress the true lumen, compromise blood flow to vital organs, and eventually lead to aneurysmal degeneration or rupture. Vascular surgeons play a central role in medical management. They treat the treatment of complications, endovascular repair, and long-term follow-up. Treating the thoracic aorta. Thoracic endovascular aortic repair, or TEVAR, has transformed the treatment of descending thoracic aortic disease. Through small groin incisions, vascular surgeons advance a stent graft into the thoracic aorta and deploy it across the primary tear or aneurysmal segment. The goal is to change the flow dynamics of the aorta by reducing blood flow into the false lumen, lowering false lumen pressure, expanding the true lumen, restoring blood flow to branch vessels. This approach has become a cornerstone of modern treatment for complicated type B dissections and many descending thoracic aneurysms. Treating the abdominal aorta. For abdominal aortic aneurysms, vascular surgeons commonly perform endovascular aneurysm repair, or EVAR. Like TEVAR, EVAR uses a stent graft delivered through the femoral arteries to exclude the aneurysm from circulation. By creating a new pathway for blood flow inside the graft, pressure is removed from the aneurysm wall, significantly reducing the risk of rupture. EVAR has revolutionized AAA treatment by allowing many patients to avoid large abdominal operations while achieving excellent outcomes. The job of the vascular surgeon does not end after TEVAR or EVAR. Patients require lifelong follow-up with imaging studies to monitor the false or aortic growth, false lumen repair, endo leaks, device durability, and the need for future intervention. Because aortic disease is often progressive, long-term surveillance is essential for maintaining durable results and preventing future complications. The vascular surgeon's role within the aortic team. Modern aortic care is highly collaborative and often requires a multidisciplinary team. Depending on the location and complexity of the disease, patients may be cared for by cardiac surgeons, vascular surgeons, interventional specialists, radiologists, anesthesiologists, intensivists, and specialized nursing teams. That's a lot. Within this team, vascular surgeons often serve as the primary specialist for disease involving the descending thoracic abdominal aorta. They are responsible for interpreting advanced imaging, guiding medical management, determining the need for intervention, and performing procedures such as TVAR, EVAR, and VVAR, and branched endovascular repairs. Vascular surgeons Vascular surgeons also play a critical role in managing complications such as malperfusion, aneurysmal degeneration, endoleaks, and aortic remodeling after intervention. Beyond the operating room, they coordinate lifelong surveillance and help ensure patients receive comprehensive care throughout the course of their disease. Together with cardiac surgeons and other specialists, they contribute to this team-based approach that allows patients with complex aortic pathology to receive individualized state-of-the-art treatment. What an article, what a mouthful. Oh, wow. But it is really interesting to learn about these different disciplines. So that is a vascular surgeon, and we learned a lot today. Feel free to go back and read it because that was a lot to take in. All right. Thank you so much, Alvaro, for that. Let's move on to our Therapeutic Thursday. So as you know, John Quick, our therapist here at Aortic Hope, will show up about twice a month and bring to you a special guest. And if you're interested in joining this program, be sure and sign up. There's a link right there in the graphic, and we'd love to have you. Just hit that link and sign on up. So this past week, we have John with Nikki Jansen, and it was really good. It's on our AHTV channel, and it's definitely worth a watch. And someone did tell me, a little birdie told me that apparently there will be a part 2 to Nikki and John's programming coming up on June 25th. All right, so let's just go through. He gives us a little bio of himself and how he got into being a therapist. It's really interesting here. And he does volunteering work and helps with the more holistic, less medically attendant life issues that accompany this condition. He says most of this begins and ends with fears that we have with this condition, which play out in their multiple guises, such as anxiety, fears of recurrence, damage to confidence in life, energy levels. And he says in his experience with clients in all walks of life, not just here, fear sits at the root of most of the challenges we face, but it gets hidden and disguised in many coping strategies. And that's from John. And he's an excellent therapist and really enjoyable to listen to and take some things away from the brilliant things he imparts upon us. Thank you, John. Thank you, Nikki, and check it out. All right, as you may already know, we have our third patient guide. So the first being aortic dissection. The second one is aortic disease, the patient guide. And this is our third patient guide. And it's stories by real patients. And we are inviting all of you to join this and send us a one-page story of your aortic disease, your caregiving, anything to do while you're here at Aortic Hope. We want to hear from you. We want to hear the full story on one page and include a little photo. And go ahead and click on our link here at stories@aortichope.org, and we will get you in this book. Thank you. We would love to have your participation. It's so meaningful. And we're really excited about this third patient guide. And of course, our Survivor Series and Where Are They Now campaign. This is my favorite. This is probably one of my favorite things that Aortic Hope does. And I really enjoy receiving these stories and putting them to life on whether it's the AHTV YouTube channel or on our blog and in a written form. We'd love for you to participate. These stories really resonate with the community and are such an important role within this community. So click on the link and sign on up, and I will be receiving your email. So I will get back to you ASAP, and we'll get you started, whether it's in the written form or we record you and put you up on video. Thank you. Looking forward to hearing from you. And Sunday, we wrap it up the week with Kevin Songer and Qigong. And this is so great. He oh gosh, he brings the Qigong live from his beach in Florida. And he's a master at Qigong. And if you haven't tried it, check it out. It's very similar to Tai Chi. It's a gentle way to move your body and get exercise and be mindful all at once. And he leads you right through it in such a awesome, professional, fun way. And we really appreciate Kevin Songer being here, bringing us Qigong, because movement is everything with this disease, and it's really important to move if you're able to, if your doctor says so. But this is a very, very easy way to get moving. Check it out. Check it out. Check it out. All right. And this is our events page. And if you haven't checked it out on the website, it's under the tab events, and it brings to you all things Aortic Hope. And we have our support groups, all the different support groups, and the times and the days. And coming up, we have Aortic Kitchen with Chef Rob and Mindy, the dietitian Mindy. And the topic is escaping me right now. Last week it was eggs, which was so cool. I really enjoyed that egg segment if you haven't checked it out. So the kitchen with Chef Rob and Mindy are coming up Sunday the 21st. And then Week in Review will be brought to you by Karen Anderson herself next week, which is always an enjoyable watch. All right, that wraps up the week. Thank you so much for joining me. And thanks to Cook Medical and Edwards Life Sciences for their sponsorship and support. We really appreciate them. We appreciate you being here. Don't forget to like and subscribe, and we will see you next week. Thank you and have a great day.